Namaskar. Apollo 24/7 welcomes you all to the Health Hour. Health Hour is a show where we bring you experts from Apollo hospitals live to this show where we are going to take your questions and queries. You must be watching this on Instagram or Facebook and on YouTube channel of Apollo 24/7. But if you want your question to be answered or if you have a query, please hop on to Apollo 24/7's YouTube channel where we shall take your questions from the chat box. And on the show, we do have a health quiz. Also, we give out discount vouchers and gift coupons towards the end of the show. So please stay with us. And if you have a question, as I've told you, यूट्यूब चैट पर आप क्वेश्चन डाल दीजिए, मैं पढ़ के सुनाऊंगी हमारे एक्सपर्ट को और आपके क्वेरीज के आंसर्स भी मिल जाएंगे. एंड टुडे वी आर गोइंग टू टॉक अबाउट समर स्किन केयर गाइड, acne, allergies, infections, and everything about summer that you need to understand. And today's expert is India's best dermatologist. We have we are presenting you Dr. Professor Sumit Kumar Bose, who is a dermatologist from Apollo Indraprastha Hospitals, New Delhi. Sir has more than 30 years of experiences. Dr. Professor Sumit Kumar Bose is a professional member of Indian Association of Dermatologists, Venerologists and Leprologists, Association of Cutaneous Surgeons of India, and also the International Society of Dermatology. And Sir has authored more than 75 publications. He is the additional professor of cutaneous surgery, advisor to NCT Delhi, and he specializes in the treatment of vitiligo, hives, acne marks, pigmentation, anti-aging, all the graying hair loss, allergies, and chronic skin conditions. So it's a privilege and an honor welcoming Dr. Professor Sumit Kumar Bose to the show. Sir, namaskar. Honor to meet you.
Good morning, everybody. I'm honored. Good morning,
Thank you,
everybody. And welcome to this show. So let's
Yes,
talk
sir.
about climate change and what is heat-regulated disorders. So here you have to have a basic idea about what is happening. So climate
Yes, sir.
change causes global increase in temperature, frequency, duration, and intensity of heat events. In the past 20 years, there is a 54% increase in the heat illnesses in adults above 65 years. Depletion of the ozone layers causing sunburn, aging, cancers, tanning, photoaging has
Sir.
increased many-fold due to UVA, UVB, IR, and blue lights. So you have heat related and exaggerated disorders like acne, heat rash, and
Gee.
also which has increased because of the many folds of increase and change in the hot weather and humid climate. Human
So, sir,
thermoregulate.
yeah. तो आप जैसे बोल रहे हैं कि गर्मी is not just one phenomena, but climate change has added more complexities to our health.
Climate change including ozone depletion, yes.
Okay. So क्या हो सकते हैं सर, इनके प्रभाव क्या हो सकते हैं? What can be the adverse effects?
Well, there can be many because the body actually regulates the temperature to around 37 degree from 35 to 37 normally, and in case of emergency like you have a heat very hot weather and you're sweating badly, so normally your regulatory mechanism, which includes the immunoregulatory mechanism also, regulates your temperature between 37 and approximately 41 degrees.
40.
But this can break up. But this can break up in older people, or people with diabetes, or people with hypertension, or people who are taking alcohol, or who are doing a sports job. For example, it can collapse because the amount of sweat lost could be very high. So
Okay.
normally you
Okay.
will be taking, say, 2.5 liters of water to control your body electrolyte mechanisms. But in case of you're doing a sports job, you may lose a lot of these sweat, and so you have to
Fluids.
take up to the 500 ml of bottle for every hour of workout. The
Wow.
people
So
who
is it
out
just for people who are, more physically active or, physical labor that they do out in the heat? Or is it also
yeah,
for
yeah,
elder population who are indoors?
everybody is affected. Labor is affected because they sweat a lot, and the sweating mechanism can collapse After a certain time, you require a lot of fluids. Every hour you require at least half a liter. And normally for normal sports activity, you will lose 200 to 300 ml per hour. So I think better to be prepared, take cool drinks, and have glasses with electrolytes ready when you're working up. Most of the labor people don't do so. The body
Right.
apparatus fails and go into several disorders, which can, the last one is a heat stroke, then exhaustion, the heat cramps, and heat related other disorders, so which can be
Yeah.
prickly heat
So
in sense.
yes. So, sir, while you were saying it could be heat related illnesses or heat associated illnesses, can we broadly
Yes.
classify them?
Well, heat related illnesses is the most dangerous is the heat stroke. Then you have heat exhaustion, then
Yes,
heat
sir.
syncope where you collapse, and then you have heat exhaustion, which is very common.
Yeah.
Then you can have heat stroke can be very risky because it can put you into a situation where you actually the urine passes, you collapse, and you're talking rubbish because it's affecting your
Right.
neuroendocrine system. So it's an emergency. It has to be taken straight away to the hospital. You have cool IV drips, you have cool sprays, and you make sure the patient is well hydrated. And if the patient is suffering from diabetes or any endocrinopathies, or
Yeah.
if the patient is taking any medicines or he is taking alcohol, so you have to be more careful because these can exacerbate all the problems.
Right. So that is heat related and heat associated.
You have
Something bahari pe.
heat associated can be many diseases. Commonest you see is acne. You can have allergies. You can have asthma. You can have, for example, a heat rash, and then that's because of the external. And then the other thing is that if you're using heating substances, for example, if you're taking a hot blower, then you can damage your skin, can cause heat aging, and several other problems. Because we talked about it many years back that if you're using a blower to, I mean, dry your hairs,
Just
it
create
can be
your
very damaging to your body. Next is,
Okay.
for example, you should wash your face with cool, several times a day with cool water, because that prevents little damage to the skin, and oil glands, and probably the oil secretions is removed and the cloths. And secondly, loose clothes, wearing an umbrella or wearing a hat or wearing goggles, so you can prevent. And having plenty of fluids, and you have the sports drink, you have the, in village situations, you have a, bottle of water, you can put electral powder or ORS, or if you don't have any place to go, then take a glass of water, put a pinch of salt and 4 pinch of that. I used to do it in Africa when we used to tackle the diarrhea people. So they used to go
Right.
and get dehydration. So you have one passage of loo, and then you take 2 glasses of water. Same thing you can do when you are having problems and you don't have a situation, you are exhausting or you're collapsing or you are feeling lethargic. Immediately do this, and it will prevent.
So,
Secondly, the cool spray. Cool spray is important. It's not very prevalent in India. You carry a bottle with cool water and you can do a cool spraying on the face. So that prevents a lot of conditions. So you cool spray on your body, so you disseminate the heat, so the body regulatory system can come back to normal. Cool
yes,
water, and
especially,
you can also,
yes.
if you have ice packs, you can put it on the axilla, you can put it on the groin, and you can put it on the face, so it cools the body. So that helps. And you can
So we are
carry a
not,
small little.
Yeah, sorry, sir. Sorry to interrupt you there. I understand that there is a slight delayed voice and picture delay. So please excuse me for interrupting you in between. My question is, sir, India being very, very hot, humid, and having temperate kind of climate in seasons, we were not ready for this kind of heat waves that we are experiencing in summers right now. So, do you think all
That's
these
because
newer measures?
it, no, no, that's because of the climate change. You are getting sudden increase in and changes in the hot weather, the humidity, and also heat-related disorders, especially people. And you know, the coronavirus has caused disaster everywhere in the world.
Yes,
Diabetes has increased, hypertension has increased, every kind of diseases has increased, and the long corona effects are causing big problem in the human race, and these can actually make them because there is an immune compromised state with the corona infection, so the patients are more prone to heat disorders.
you're
Moreover,
right.
certain countries like in Australia, you have an ozone depletion, so there are sun related problems and the IR
Correct.
related problems. Everywhere the problems have increased because of sudden climate change and ozone depletion.
So we need to adapt to new measures. जैसे आपने बताया कि cool mist हो या axilla में बोले underarms के नीचे ice packs हो, all these are the newer measures that we need to adapt to.
Yes, and you should always don't do oil massage because this increases the fungal infection. And in sweat areas, for example, if you are sweating a lot, you should carry your cool drinks all the time, which I mentioned before, and wear cotton clothes and very loose ones. And white ones are better than dark ones. Always wear a hat so you can prevent the direct heat coming up from the sun hitting your body or the body. And you see in Arab countries, they wear a lot of these white
One
dresses. The
and
reason
the robe
is
on the head.
the reason is to prevent a direct heat contact. So basically that, but the black ones absorb more heat, so it's preferred to use totally white
All
dresses.
right. So as we are talking about the sun, the skin tends to get oilier in summer. Though we are losing a lot of sweat, our त्वचा जो बनती है sweat lose करने के लिए पहला माध्यम बनता है. उसके बाद में oily भी बन जाता है skin. Here is the first question Rishabh Tokas. Sir, मेरा skin बहुत oily बन जाता है. Please suggest skincare for oily skin in summers.
Very easy because the problem is when you have oily skin, you can use a medicine which is containing benzoyl peroxide foam, so you can remove it by frequent washing, or you can, if you have nothing, you just wash your face with cold water and wipe it. That's all,
How
and
many
you
times do
keep
you
the pore.
suggest, sir?
I think five times, 6 times. The more
So
if
we
it is I think the method of washing your face with cool and washing your hands and feet every time, that's the way you can cool down, because you know if you have initially an old man, you can have heat edema of the feet, which is a part of it, and you can avoid it by drinking a lot of fluids and washing your hands and feet with cool water and putting a lot of cool water on your face and maybe using a cool spray.
yeah. So Rishabh, I think
But
that's a simple solution.
I think another thing is that if you have gone to a dermatologist to remove the facial oil, they use salicylic acid washes, and of course, but they can cause dryness, and probably the best is the benzoyl peroxide, which should not be kept long, but should be kept at least 30 seconds so you get rid of the oil on the face. Plus, you don't have pop up of tropical acne coming up.
So ये
Cool
पूरे over the
face,
counter.
yeah, you can get benzoyl peroxide soaps in the market, which has different names. So benzoyl peroxide soap is one of the best way to just washing your face several times a day with cool water and a foam of the benzoyl peroxide soap. You can prevent a breakout of acne
Wonderful. So
and
that's for
oily
oily
skin.
skin. Yes, sir.
That's the
Yes. So
simplest way. Before you visit a
Huh.
dermatologist, you will like to prescribe many other things.
Okay. Wonderful, sir. So, next question is the suntan. So, summer's sun exposure and suntan. Here's Krishna Teja who's asking for D-tan. And this is the right opportunity to talk about the importance of sunscreen as well, sir.
Yeah, I think basically sunscreen has been in use for several years, but there were some chemicals in sunscreen which has asked the experts why not use sunblock, the mineral sunblocks. So sunscreens are good, but then you see you have for a person like me and you, we are not very fair, so we would like to use an SPF with sun protective factor of 15. That's enough. But if you are too fair, then you can go up to a sun protective factor of 50 plus. Most of the
Okay.
mineral sunscreen has a sun protective factor because they block the sun rays, whereas the chemical sunscreen don't totally block the sun rays. So they cause tanning, but the mineral sunscreen would not cause tanning because the rays cannot pass. And of
Okay.
course, the problem was that when mineral sunscreen was initially, I used to use around 30, 40 years back. We used to make 10% titanium dioxide and maybe zinc oxide. They used to, like the cricketers used to be totally white. It doesn't look nice. But they have innovative ideas. There have been a lot of controversies in which they found that microparticles, not macro, but micro or macro, because macro is preferred, or particles of zinc oxide can actually prevent without causing side effects. So probably, and people who are dark like me and you, and now probably we can use a tinted sunscreen, which is iron oxide, which can actually even control your infrared radiations and blue light. So why not?
Wonderful. Well, that's an
So you
easy
have
solution.
of course, you have to use normally the sunscreen. You have to make sure available in the in the market has to be a mineral based sunscreen rather than a chemical based sunscreen, because
So,
chemical based
let
sunscreen,
me put that
some
all
of them,
together. If you're a dark skinned person, SPF under 50 is good. If you're a fair skinned person, SPF above 50. And it should be a mineral sun block, which will block the sun rays, UVA, UVB. If you are slightly on the darker tone, like most of the Indians have, then it's good to have a tinted sunscreen, which will also have an iron oxide. So, please correct me if I've gone wrong
ah,
in summing up.
yeah, yeah, it's okay, it's fine.
Yeah. So, moving on to the next question, sir. आशीष अग्रवाल जी पूछते हैं, गर्मियों में फेस और बॉडी पर लोशन या क्रीम लगाना चाहिए क्या? अगर लगाना है तो सबसे बेस्ट कौन सा है?
Sunscreen, some of them can cause acne. A moisturizer can cause acne, which is called cosmetic acne basically. And probably you have to look for non-comedogenic moisturizer and non-comedogenic sunscreen. So you have available in the market, the dermatologist will suggest that, which you can use without causing damage to the pores or blockage of the pores. But the
जी.
simplest way is wash your face many times. You keep removing the oil, excess oil. Do not use oil massage because that can not only block the pores but also it can harm the skin, pigment your skin, and many other problems because oil is not pure. And secondly, most important thing is it's good for winter you can massage oil, but not for summer. And the fungus or the bacteria like to eat your keratin and the oil. They live on oil, so because and if you're occluding your skin with oil massage, these staph aureus they start growing. You see, I have a very good example. A guy who went had a very hot bath in a foreign country, He had pseudomonas folliculitis coming when you visited my clinic. So you have,
Oh,
you can hot, very hot bath can have bacteria and fungus in it and can stick to your body and cause sometimes folliculitis and sometimes fungal infections. So one has to be careful that the water is clean and don't take a hot shower in summer. It's not recommended.
huh, right. So, yeah, we've started off a discussion about folliculitis and how common is this in India, sir?
Yeah, it's common because of the oil massage. Even there are conditions like deep obstruction of the sweat glands. This is called malaria profunda. And these occurs because of the oil massage. You know, you're massaging oil, and your perspiration glands are not open, and they are not able to. You know, when the sweat comes out of the body, it cools your body, and you're basically blocking the sweat by applying Vaseline or oil or whatever it is. So you're causing folliculitis by oil massage and Vaseline massage or whatever you. So anything you apply has to make sure that it doesn't block your pores or your
Right.
apparatus that helps in sweating and cooling your body. Very important.
Fine. Very, very important, sir. Yes. So next question is Shikha Jain's question. Shikha is prone to she has sensitive skin and acne prone skin, especially in summer. Any suggestions for her? And why does acne
Yeah,
increase in summer, sir?
it's because of the climate. You know, the glands. They get activated. The oil glands actually the one responsible. There are certain bacteria also,
Okay. So any
which were.
solution for that, sir?
I think frequent washing, as I mentioned before, with a acne cleansing bar or liquid or a soap, which removes the excess organisms that causes acne, and also removes the oil that blocks the pores that causes increase in acne. Plus cool
Yes.
bath in summer, cool sprays as I mentioned before, and carry your little small fan so
Yeah.
your face is all cool all the time.
Yes. So here's something similar in a question, sir. Adesh Venkat Subramaniam is asking this question. I have very oily skin, have a lot of acne on one cheek and other does not have. So I need some help here. That's his question.
Okay. That acne basically is a genetic problem with endocrines playing a role. So it can happen on one cheek or both cheek, in the chest and back, and even sometimes we have severe acne which can happen on the buttocks also.
So it's genetic and it doesn't have
So
to do anything with summer.
yeah, it's genetic, controlled by the environment, controlled by your having several disorders. For example, I'll tell you, most people you see, they have hormonal issues when they cross 21 women, when they have acne. And men, when they have acne, they had their parents who are either having acne or grandparents having acne or having diabetes, because they did a
Right.
study in which found that people who have acne, there are a lot of controversies, but the people who have acne, quite number of them in my practice in last so many years, I found that these people have basically parents who have diabetes or their grandparents diabetes, because usually the
Right.
genes skip. You know, the grandfather was diabetic and you are a granddaughter, and you have more acne than
Right.
a normal
So
woman.
I think Adeshi, it's better to consult a dermatologist because this is not just a summer problem. It is more deeper.
Yes.
So Apollo 24/7 gives you
Yeah,
an opportunity of
I think
consulting Dr. Bose.
for everything, you need to consult a dermatologist who is an expert in
Correct, sir.
doing the job.
So Yes, sir. So this is not the platform where we can further discuss your problem. So please do consult. Apollo 24/7 allows you to consult and book Dr. Professor Sumit Kumar Bose in case that you require his consultation as well. So next question is a 17-year-old Cheyenne. He's a male. Hands and feet become extremely dry and cracks start bleeding with the change of season. I've used a variety of creams but with no help. What do you think is the reason and solution, sir?
Well, that's because you have two is one is the psoriasis or psoriasiform dermatitis, or and psoriasiform dermatitis. Basically, you have contact with your working conditions where you touch certain things and you get a scaling or cracking of the hands and feet. So it's a big subject. But basically, normally, if you moisturize your hands and feet regularly, when you have a tendency towards these conditions, and probably that will help. The commonest is the Vaseline, which you can massage on your hands and feet. And in case if you have cracks, a Silver X ionic gel or Hydro Heal is available in the market, which you can use to heal those cracks, because then they can get infected and cause other problems.
Right. I think yes. These are not the. These are a little more slightly complicated issues. I think, Shayad, you
I think
should consult.
plus there is a lot of genetic basis on these, because most of the diseases that do not happen normally in the population in some individuals are basically genetic. You are genetically dry skin, which can happen all
Right.
over the body or hands and feet. You have
Mm.
genetically diseases like psoriasis or psoriasiform dermatitis, which basically can affect these hands and feet.
Right. Right. So yes, as you said, this is more genetic and should be, better consulted personally with a dermatologist. यहाँ से आप continue कीजिएगा please. So there's the next question. Debabrata Bishwas, I'm suffering from scleroderma diabeticorum. Please suggest any advice, sir.
Well, well, scleroderma is not a very good condition to get, diabeticorum, and it's immune mediated again, and especially people who are having insulin dependent diabetes, they are the ones suffer, and the skin becomes hard like a like a
Oh,
board. You can just knock it off. So it's very hard at the back, at the back, and you can feel it. It's like a stony hard structure, and it can be a little risky. So we try to improve the circulation there. We give vitamin D and maybe a little steroids also, and certain immunosuppressive medicines. And in the long run, with simple massage, a hot olive oil massage with all these conditions, the patients improve. But you see, one is the diabetic control and the infection control in the body and the circulation control, because sclerosis underneath the skin occurs because there is a circulatory problem. If you go into the etiopathogenesis of these conditions, there is increase in collagen and subcutaneous levels. They become very hard. So you see, you have to be very careful. You visit a doctor and an endocrinologist. I have seen several cases in which we prefer to cooperate with an endocrinologist and me, dermatologist. That's why we do better. And we have got
correct.
very good results. They are autoimmune controlling drugs, immune modulatory drugs that we use, and local massage. They should be able to do the job.
Wonderful, sir. So it's a multidisciplinary approach that he requires,
Yeah, yeah.
not just of
Always,
a dermatologist, but also
always,
endocrinologist. Yes.
always a collaboration between different doctors.
Wonderful, sir. थैंक यू सर. चंद्रशेखर पाटिल जी पूछ रहे हैं सनस्क्रीन फॉर इन्फेंट्स कुछ है क्या?
Yes, there are sunscreen for infants is available in the market, and usually the sunscreen should be used for delicate skin children, and these sunscreen should basically, I don't like to write any sunscreen for children. You just mother should
Yes.
use a umbrella. That's all.
Yes,
Because if you
especially in
use
fans,
oil,
you
hey,
it's not even
I have
twice
seen.
till
I
so that freeze okay दिख रहा है मुझे. So let's see if sir is with us. Technically, I think we have a small issue there. In the meanwhile, let me tell you that Apollo 24/7 you can consult our top specialists, especially summer में जो climate change के related heat waves अभी आने वाले हैं across North India and also South India. रीजन्स का बहुत ही हीट बढ़ने वाला है. सो बी माइंडफुल. अब तक जो सर ने बताया है कि हमें वाटर इनटेक बढ़ाना है. अगर आप इफ़ यू आर अ पर्सन हु इज़ वर्किंग इन द सन, or if you're a sports person, or if you are a physical labor engaged, somebody who's engaged in physical labor, you need to consume half a liter of water every hour. And then you also add electrolytes to it, just a pinch of salt and 4 pinches of sugar. That should be enough. And that's the basic care that you can do. And in case that you are going, if you have a doubt that you have प्रॉब्लम विथ योर बॉडी टेम्परेचर थर्मोरेगुलेशन कि अगर आपका बॉडी हीट से सही से हीट को रेगुलेट नहीं कर पा रहा है, then you will have to make sure that you are cooling down your body by spraying cool water all around your body and leaving an ice pack underarms or in the groin area so that your body can start to cool back. 37 से 40 के बीच में आपका बॉडी टेम्परेचर वो मेंटेन करना चाहिए. And these are the basic requirements. Yes, Dr. Sumit Kumar Bose is back with us. I was just
yeah,
reiterating what all you have said till now, sir.
right.
Uh, yeah. So, next question that I would want to ask is Mr. Kamal, who's 46-year-old male. My feet sweat a lot in summer and I have a very weird smell. Can you please help?
Oh, this is because of the sweating, and this sweating is basically genetic, in which the autonomic nervous system is working, and sympathetic parasympathetic. Basically, it has happened more after the coronavirus has actually damaged the vagal nerve or the autonomic nervous system. But there are ways you have to actually use certain washes containing aluminum hydroxide, and these washes and other available in the market. They are available even by different, and then there are
Right.
oral medicines to be prescribed by doctors to control your excess sweating. Stress can induce sweating. There are different types of sweating. You know, you have a hot, spicy food, you can sweat more. If you check bland food, you sweat less. Go into a hot weather, you sweat more. Before the examinations, you sweat more. So, what I tell people is you carry those roll ons, anti sweat roll ons, no sweat, all dry. There are many available in the market. So, just roll it on and put a little powder which can absorb. And because the sweat can increase your fungal infections, so I like to use ketoconazole or a clotrimazole based absorbing, sweat absorbing powder. And there
Yeah.
are a few brands available in the market which you can use after you have used a sweat reducing roll ons. So that's the way to go because you can't stop. The other is when you visit a dermatologist, they use a machine called the ionotophorosis to control it, or in very difficult cases, there can be surgery. And last thing, now preferred thing is neurologists use a Botox to control it. But these are very high flung things. I think we should talk about basic things like
I
using
know,
an
I know. It's
anti-sweat,
not for everybody.
yeah, anti-sweat lotion and probably an anti-sweat powder.
Yes. So I'm wondering how my audience has still not come up with the fungal infection or the bacterial infection questions. But there is a question about summer's itch. Sir, maybe know what a summer's itch is.
But summer itch can be many conditions which can cause summer itch. One of them, the heat rash, can cause summer itch. And the other is the heat itself can cause itching in the body by dysregulating the mechanism or damaging certain fibers in the skin, which conveys certain messages to the brain, the so-called the itch receptors. So anyway, so it's all depends. The summer itch is of course controlled by cooling your body, cool sprays, lot of cool drinks, things like that, and cool shower. And if you're too much exhausted, then of course a cool bath. And sometimes I tell people that you have very cold water, a tub, and you just put yourself in, check your temperature. If it is 37, it's okay. From a higher, 41 and all, you come down to your temperature, but keep checking your temperature. It should not go
Yeah.
below 35.5. So that's it.
Yeah.
Then
Wonderful,
the
sir.
body's
So
mechanism to take care.
yes. So while
Rash, of course. Let me complete.
yeah,
Rashes, of course, there are heat rashes, which is called malaria, and these can be just an antihistaminic calamine lotion you can apply, and maybe a 1% hydrocortisone solution. The heat rash will be under control. But don't forget to hydrate. Don't forget to cool your body. That's very important because malaria can show up in your face as small little blebs, which is because of the blockage of the apocrine glands, which is the sweat glands. And they can be also pustular and papular and very deep as profundus. So these rashes can also give you pain and burning and itching all together. So just simple thing is wash, cool, drink, wear proper clothes, and of course use an antihistaminic. But that also can dry up your body. So it's better. I prefer to use the topical preparations and 1% hydrocortisone available in the market with calamine lotion and antihistaminic in it. So that's safer. You take oral antihistaminic, there's a problem because it itself can cause dehydration.
so it has to be on your skin, something simpler like a antihistamine cream or a calamine lotion. So next question is Padmaja asking about the similar thing. Outside food leads to my allergies, and will outside food cause a fungal infection on skin?
Yeah, because many food I've seen they add sugar, and if your parents were diabetic or your grandparents were diabetic, you're prone, your sugar levels increases in the body after taking outside, and there are a lot of bacteria and others. You can have diarrhea, and that itself can cause heat conditions. So, especially after 65, for example, myself. I'm 70 above. So what I feel if I take food, anything from outside, it's so damaging, and I have loose motions and I have itching and rashes coming up. So prepare simple bland food at home. And if you're in South
Yeah.
India, just Uttapam, Upama, that's nice food you can just have. And, or Italy, they're not damaging. But don't take too much of spicy food because that can dysregulate your mechanism to control heat. If you're taking too
Yes.
much of hot spices during the summer, your mechanism, and then going out in a very hot weather, and that can actually cause problem. Moreover,
Right. So
alcohol.
yeah,
Alcohol
alcohol.
is not good. Too much of tea, coffee, it's not good because that can dysregulate the mechanism of heat regulation in the human body, and you cannot face the drastically temperature outside.
Yes, sir. So, while we're talking about fungal infections, can you also talk about prickly heat, which is very common? And अभी तो इतने सारे advertisements निकल जाते हैं prickly heat powder के. तो कौन सा powder हम use कर सकते हैं to control sweat and prickly heat?
Basically, prickly heat is because of the blockage of the sweat apparatus due to dysregulation of the human sweat system. So the best thing is to have a cool spray on your body. Do not work when you. I mentioned that before. If you are working in a very hot, humid atmosphere, you should carry a lot of this electrolyte drinks, which we call the sports drink. Or I mentioned about this one glass of water and one pinch of salt and four pinch of sugar, which you can take so you don't get these sweat rash. We call it the sweat rash and the malaria or the prickly heat rash. And there can be many different types. And they can be superficial. And if you don't disinfect, I prefer that people should use uh, Corona and antifungal soap. They are available in the market. So if you have a soap which controls the bacteria in the human skin, the fungus in the human skin, and if you regularly hand wash with that, it should prevent to a lot of extent, because the sweat, when it's there in the skin, it's growing your fungus, because fungus loves sweat, and the bacteria also loves sweat as well as the oil that you are applying. Also, there is, and when there is an occlusion because of the failure of the sweat apparatus, you have the bacteria growing and the fungus going, and the whole mechanism of control of the human temperature is disrupted. So,
Correct.
the best thing is, again, I told you, use a calamine lotion, take cool drinks, and
Right.
uh, an antihistaminic if the doctor wants to prescribe. With a lot of
So
drinks, of course, that's important.
yes, that is the first point, that you have to hydrate yourself first.
Yeah.
So, how about the powders? The market is full of powders which are especially formulated for summers and the prickly
I
heat. So,
think,
what would you
I think
advise?
that the only one is starch-based powders, which is safe,
Starch based.
and the other is there are certain antifungals that has been found to be maximum available for your skin, which is the epidermal, covering your whole body. So for that, the bioavailability of ketoconazole, which has been found to be better than most of it others. But there are others, but then this is probably so a ketoconazole based, starch based sprinkling powder would be advised. But then you
Right.
have clotrimazole based powder, and I don't know what are the ingredients they are putting. It's also effective as long it is not blocking the pores and absorbing the sweat. So the basic funda is remove the bacteria, use a ketoconazole based, and
So,
absorb the sweat. Absorb the
the
sweat.
powder.
So the sweat, the powder. The powder is very important. That the powder should absorb the sweat and not cause occlusion, plus not cause allergies. There are powders which can cause allergies also. Very important.
Very
And
important. So, hydrate,
and
stop the bacterial growth, and then use a
and
powder which can absorb.
cool the body.
Cool the
There are
body.
powders
Yes.
that can cool the body.
Yes, sir. Simple solution. पहले cool करो, उसके बाद में बाकी सारे करो. There's I think this is not the platform to ask, but yes, I have very dry fish scale like skin in winter. Body becomes flaky. Solution. I think not for this season, but please do go ahead to answer this, sir.
Well, this is very simple because you have a condition called ichthyosis, which old people usually suffer because of senile ichthyosis, and there are different types of ichthyosis. All are genetic, and you see from your childhood when you're growing, you see a parchment-like skin of the hands and feet and body. Sometimes there are different genetic conditions where you have different presentation. Basically, when you have a disorder in a village situation, the simple ghee massage is very helpful.
Okay. Okay.
You have several ointments, which is a simple mineral oil or a paraffin oil or a Vaseline based, which is soft paraffin massage. That would be, and then you have urea, which can range from 1% to 40%, which you too dry, and then you can use 10%, and you can go further up. It's too dry. And these are very safe in urea based and all. There are many other medicines available in the market when you have like thiasis. And we prefer to use sometimes oral retinoids, which is a vitamin A derivative, in difficult cases where you have thick palms and soles. So the best suggestion is consult a dermatologist.
Yes, sir. That's the best solution. Consult a dermatologist because it's not that easy to discuss on this platform. And that's the next question is Sony, who is 27-year-old, mother of a newborn. I have summer acne. Please do suggest a routine so that my child does not get affected when he comes in contact with me. So, is it
It's
basically
not the it's not the contact that causes acne. It is the genetic, and genes can be transferred into small child, and you have neonatal acne because of that. It has got to do with the hormones of the body. The female hormones can cause neonatal acne in children, which is for a short time and goes away. But sometimes, if you have people like your grandparents or your relations having acne, you can get acne. So basically, it is genetic. And there is a dysregulation of the glands, which is called the sebaceous glands, controlled by the hormones and certain bacteria floating in your skin, which is natural, of course, but they become naughty in patients who are genetically prone to acne.
right? So,
So,
she need to
uh,
worry
so
about her
uh,
child getting it.
no, not always. There is a possibility of getting neonatal acne because in during the pregnancy, there is a hormonal dysregulation, and this dysregulation can cause diabetes and thyroid and other things, and child during a short time may get what we call the neonatal acne. But that's
Right,
not always true, but
right.
no connection with having touching the baby.
Right. Thank you so much for
and,
clearing that, sir. Next question
and
is
the
Harsha. Please.
dermatologists take care of the part of the acne in the woman.
Mother. Yes. Harsh Mehta, 20-year-old. So, dandruff and dry scalp, acne on my face. Summers, it gets really difficult to manage. What are the suggestion for hair? We've been talking about skin all this while. So, hair also does get affected.
Yeah,
Any
the
suggestion?
problem is that people probably didn't know that the dandruff is actually a sort of a fungus which is called Pityriasis ovale, and this fungus also causes many other problems. Like if you have dandruff, you can have a condition what is called tinea versicolor coming up in your chest with different colors. So basically, dandruff is a sort of a fungal infection. So best thing is you can use antifungal, anti-dandruff shampoos available. I think there have been a lot of revolutionary things going on this field, and I would like to suggest what shampoos to use. But it should reduce the scaling, thus reduce the itching, thus reduce the dandruff. And of course, if you take too much of milk products, it increases the dandruff. If you have hormonal dysregulation, it can increase the dandruff. If you take too much of sweet and fried and oily food, it can dysregulate. If you have hormonal mechanisms, or you have a thyroid disease or diabetes, it can increase your thing. And of course, if you're taking certain medicines, it can also increase your dandruff. So there is a very complicated subject, but what studies have shown, in the 80s, we did a study in which we found two things. One is a natural product, and the other is what we call the ketoconazole shampoo. We did a study in which we found that it is able to control five things, rather four things. Control the oil secretion of the scalp, the ketoconazole shampoo, control the growth of the organism that causes the dandruff. And the dandruff is caused by an organism, Piperinthrum ovale, when normally suppose it is around 50% people have 50% of these organisms, but when it crosses 75% to 84%, then you start getting flaking and itching and things like that. So basically, remove them, control your diet, and just wash regularly with an anti-dandruff shampoo. And if you
Right.
still don't improve, go to the dermatologist to take care of you.
Right, sir. Thank you so much for that clear answer there. So, two last questions, quick answers from you, we expect. One, Timir Das is asking, is there any benefit of vitamin A application on skin and hair?
I don't think so. But orally yes, because we did, the Americans did a study many years back when they found that 400 milligram 3 times a day of vitamin E in summer would block the sun rays. So the
Okay.
all sun-induced damage would be prevented. Vitamin C does the same. So if you have vitamin C, 1,000 milligram a day would prevent damage to the skin and all. But locally, God knows it works or not.
Okay. Thank you, sir. And then Sampath study, Anima saying she has freckles and melasma. So, what can I do for her? She's 40-year-old.
5 things: your hormonal change, your genetic constituency, your sun, your heat, and the cosmetics. I had reported many years back that a person was using color, used to color her hair, and
Color
her
of hair,
melasma,
sir.
yeah, color of hair, and makes a melasma burst because the PPD, paraphenylene diamine dihydrochloride, has been found to increase the melasma because there are a lot of other issues in melasma, but one of them we found was the melasma became worse when she was using the hair color.
Right,
And then
right.
if she's gone to a beach and she has not used a proper sunscreen, and the melasma becomes worse.
Correct.
The other
So,
is if you have diabetic or thyroid or many other diseases, or you have endocrinopathies or hormonal changes, or if you are taking oral contraceptives or any other pills the women are taking, they can have melasma. And even in men, they have found hormonal changes, liver disorders, you have melasma, you have thyroid, you have melasma, you have. It
right.
is a
So, sunblock is important for
multifaceted.
her.
Multifaceted. So best thing is to use a sunscreen with a pigment control, which is available in the market, and the sunscreen should prevent more darkening, and the pigment control would control the pigmentation. But it's not a permanent solution. And there are vascular elements also that has to be controlled. Of course, you have to visit a dermatologist. Will
Right, sir.
suggest the
Thank you
right
so
treatment.
Yes, sir. So, Anmol ji, we have been talking about acne. हो चुका है वो टॉपिक आप बाद में रिवाइंड करके देख लीजिएगा आफ्टर द रिकॉर्डिंग we'll be putting up the recording later. So thank you so much, Dr. Professor Sumit Kumar Bose, for this wonderful instructions that you have given, simple, practical solutions that you have given, sir. But to wind up, I want you to give us some top tips to be taken care in summer.
Well, first is cool drinks, wear white clothes, wear a hat, carry an umbrella, and then of course you drink a lot of fluids that contains electrolytes. If you're doing outside job, you should have a cool spray, and then cool spray work. And at home, if you have got a heat problem, you could carry your ice packs and you put it in the axilla, or then take a, if you have got exhaustion and you're feeling bad, take a cool bath or a cool dip. That should prevent all the problems.
Thank you. Sir, I must say you are a super cool person to have given these cool tips for us.
Thank
Thank
you
you
very
so
much.
much, and we appreciate your time on a Sunday morning, sir.
Thank you very much. You are great. Have a
Thank you,
nice
sir.
day and weekend.
Yes,
Namaste.
sir. Keep hydrated, his doctor's secret. Keep yourself cool, keep yourself shaded, and take care of yourself in summers. So, चलिए health quiz का time आ चुका है. I'm going to ask you three simple questions, and you can answer these questions on YouTube chat. I'm going to pick up the winners towards the end of the show. We're going to announce the winners, and the winners will be selected at the sole discretion of Apollo 24/7 team. If I'm taking your name to be the winner, then you will have to write back to us with all your contact details before Wednesday every week to marketing at apollo247.com. Gift vouchers will be shared with you. So the questions for this week are on the screen. The first question, the most common skin problem caused by sun exposure is what? Fill in the blank there. S से शुरू होता है, blank M, B, blank R, blank. What's the problem? Please fill in the blanks there. The most common skin problem caused by sun exposure is question number 2. True or false में आंसर कीजिए. An allergic reaction can cause rash, itching, burning, redness, bumps, hives, and swelling. Is that true or false? An allergic reaction can cause rash, itching, burning, redness, bumps, hives, and swelling too. Is that true or false? Question number 3. Yes or no? Allergies are harmless. Yes or no? So these are the simple questions. Please go ahead, answer. Let your answers keep coming. I can see Madhu, Rubina, Prithvi, all of you are participating. Anmol, you're also participating. But let's see who the winners are in a short while. In the meanwhile, let me give you the coupons that you can use on Apollo 24/7. Please download Apollo 24/7 and you can use these coupons on the app. The first one that we are giving you is code ASKDOC150, Ask Doc 150, and you can consult top doctors direct from Apollo hospitals and get 150 rupees cash back on online doctor consultation. The next one that we are giving this week is code FIRST3, FIRST3, order medicines direct from Apollo, get 25% off on online medicine orders. This is valid on the first 3 the medicine orders on Apollo 24/7, which are above 1000 rupees. So get up to 2 hours delivery as well. So that's the beauty when you order from Apollo 24/7. And the one that we are giving away now is exclusively for Health Hour viewers. Use the code HH247. Get 199 off on online consultation with Apollo doctors and 20% off on medicine orders as well. So these are the coupons that we have given this week. And next week, by the way, Apollo 24/7 is also accessible on WhatsApp. 9355247247. This is the number that you got to save. You can text or call on WhatsApp as well to avail the healthcare services. And the winners for this week are Aman, Rubina, and Priya. Aman, Rubina, and Priya, you are the winners for this week. Please do write back to us at marketing@apollo247.com with all your contact details, phone number, email, address, etc., so that we can share the gift vouchers with you. And the next week episode is going to talk about your heart, how to keep your heart healthy. 7th April, 11 a.m., we are going to talk about your heart conditions. So please join us, 7th April, 11 a.m. Until then, please do take care. Thank you all for joining us. Summer is going to be scorching this year, so do keep yourself cool in the summer. Namaskar.